the point of long COVID is that patients in general, including children, do not need to have some persisting symptoms like headache or fatigue, because this can happen to each of us. But these symptoms should be severe enough to impair daily life. So that's why I stress a lot the need of this point also when we assess our patients, because sometimes I see parents that bring me their children and say, my son is very tired, but he plays football 6 times a week. Okay, so this is not long COVID. But if you only ask him to click a cluster of symptoms, this may be wrongly included in the long COVID category. So we do these in-person assessments at each time point, which allows us to have a kind of a rigorous definition, clinical diagnosis of long COVID. And then for these patients, those who have persisting symptoms, we collect some blood samples for which we are doing some coagulation studies or proteomic and transcriptomic studies, which we hope can lead us to some biomarkers of long COVID. And also we are having a personalized diagnostic approach. We do routine blood samples to exclude the other conditions, but we also do tests to recognize dysautonomia, orthostatic intolerance, and post-orthostatic tachycardia syndrome. We do the cardiopulmonary exercise testing to measure the fatigue compared to healthy controls, but also to try to understand if the origin of this fatigue is only muscular or also has cardiopulmonary aspects. And other diagnostics, for example, those having chronic headache, we have a personalized approach with our neurologists, with a brain MRI, neuroconduction studies. And then according to what we treat, to what we diagnose, we try to also personalize therapeutic approach according to any conditions, in case any treatable condition we find during this process.
Mm. And for the non-medical audience, a biomarker means that we're looking for a blood test that would indicate that you have long COVID.